so this person should definitely be doing cruciferous. Why? Because cruciferous type vegetables help balance estrogen. They balance estrogen. They balance the good estrogens and they get rid of the bad estrogen. But they protect you against cancer too, which is good. Because if you're actually eating to prevent cancer, you're gonna get healthy. You're gonna get healthy a lot faster. So we have that body type, and then we have this body type, which is your husband. This is the liver body type. Have you ever seen a guy like this on the beach with the Speedo? Now what happens, the stomach, what's the difference between this stomach here and that stomach there? It's hard, and it protrudes higher up like a potbelly type thing. If you take your hand on one side and tap the other side, it'll have like a ripple. That's called ascites. Ascites comes from the Latin, which means fluid. It's a fluid belly. The liver is leaking fluid into a sac around the gut. So here's a book on liver disease diagnosis and management. Okay, what does this say right here?
It says $215.
$215. So you know this is truthful information. So right here it says there's 3 types of liver problems. Cirrhosis, it's scarring of the liver. That's like years of eating bad foods, or drinking, or having some virus. Okay, and then you have fatty liver, which a lot of people have fatty livers. And then you have inflammation, which is like hepatitis, that type of thing. So those are the 3 things that will do that. However, the problem is that you can have a bad liver but not show up in blood tests. Luckily, though, the liver is one of the only organs that can completely 100% regenerate. It can take a beating, but you have to create enough health. It does take 3 years to create a healthy liver. Now, this person will have right shoulder pain and stiffness. They are grouchy in the morning. How many of you know people are grouchy in the morning? Okay, that's liver. And so, right shoulder pain, because liver's on this side. So when you go to work on Monday, just go up to the grouchy guy and go,
rub his shoulder.
Hey John, listen, I've been holding a grudge on you lately because of your grouchiness, but now I forgive you because I know it's just your liver. So this person usually has insomnia the last hour that they should be sleeping, so that they're trying to get that last hour of sleep, but they can't get it because they can't maintain blood sugars. Most diabetics are really liver problems. But this person has, the whites of their eyes are yellow or dark or kind of bloodshot. They have stiffness in the lower back when they get out of bed in the morning sometimes. If they eat the wrong foods, their fingers get a little bit stiff. They have a lot of digestive issues, bloating. And they have a low tolerance to fatty foods. So they have digestive bloating with a lot of fatty foods. But they crave deep-fried catfish or anything deep-fried. They like the fried foods. Obesity is a health risk, right? Because it causes what? Heart disease, diabetes, stroke, blood pressure, bad luck, death, right? And who tells you that? Who told you that? They told you, right? I don't know who they is. Right. So that is totally not true. It's not true. I had a patient came in. She was 365 pounds. She did my program exactly for 1 month. She had better energy. She was sleeping better skin, but she lost no weight. Absolutely none. Second month, she lost 21 pounds. Third month, she lost 63 pounds. So what we found was something remarkable. You're going to lose weight in direct relationship to your level of how much health you can create in your body. Obesity is a symptom of an unhealthy body, not the cause of it. It's one of the many symptoms that you have. So just let that sink in a little bit, because this is 5 pounds of fat. And the purpose of fat is not a cushion to sit down on. It's not an insulator to keep you warm. It's a protective mechanism that protects you against starvation and illness. There's 3 things that we do. One is we craft an eating plan that's based on your body type to help put the nutrition back in that's missing and get rid of the cravings. And the second thing we do is a technique. We do an evaluation to measure the reaction to stress and the recovery from stress, to find out if you should be exercising and what's going on inside your body, to see if this is a barrier that's stopping you. And then we do an acupressure technique to get rid of the stress. It's a very cool technique that extracts the stress, and it gets people to sleep a lot deeper because it gets rid of the old stress. The third thing we do is we find out what exercise you should do exactly, so that way you're never doing something incorrect. So that way when you actually exercise, you recover, you recover, you recover, and you're actually burning fat. Every person is different as far as their workout when you actually test them. What's good for you might not be good for you. And there's a lot of different combinations that occur, but if you get it just right, you can really help people a lot quicker because you're getting fixed on the inside of the body as compared to trying to focus on the outside. The philosophy is get healthy, lose weight, keep it off. And for those of you that never have gotten checked before, what we do is an evaluation. The cost of the evaluation is $95 for all the different testing. We check the fluids. We want to make sure you're not, we want to know if you're full of fluid or full of fat. And then we check to see if you should be exercising or not. And then we want to find out about your old injuries, and we can check you out. If you need the acupressure, great. If you're not, then we give you whatever you need to do to get the right plan to help you. We also give you the eating plan that's tailor-made to your body. Also, if you do want to make an appointment, we give you the book. This is my book. If you want to autograph, it's a little bit more, but no, I'm just kidding. This book has 149 images. It gets into a lot more detail than I talked about, but it also gives you the understanding behind how to get a healthy body. It's called the 7 Principles of Fat Burning, but really it should be the 7 Principles of how to get healthy. Yeah. How many have ever experienced sustained stress for many years? Okay, let me tell you what happens. I'm very interested in that because we have something very advanced that I've been playing around with, and we finally are going to officially just adopt it right as part of the treatment. It works on something that's very specific, sustained stress. Like what happens is when you get hit by stress, there's a circuit that goes up to the brain and comes down to the adrenal that over a period of time gets stuck in the position of on. Where the problem is, there's certain points in the brain called the hippocampus. The hippocampus in the brain actually shrinks with sustained stress. It gets smaller, and if it gets too small, you get Alzheimer's. So I just found an acupressure point, to that area, and I started working on it. I'm like, people are like, they're like feeling very different. Like, wow, I just feel very calm right now, like something just turned off.
In regards to acupressure, if I hurt on my left side, it has to do with wiring? You work on the other side?
Yes, it depends, because there's a whole technology to it. I mean, if you want, I can actually do some samples. I can work on some people. Does anyone have like pain right now? Anyone have pain? Okay, you have pain. Who else has pain? You have pain. You have pain. Well, maybe I could do some. I could do some work.
She can't even raise her arm.
Really? Really?
It's not my arm, it's my neck.
Oh, okay.
She married a pain.
Well, here's what I'll do. I'm going to officially end the seminar, and then you guys can stick around, and if you want to stick around, I'll do some demonstrations of how the stress technique works on pain, and just to kind of give you a little reality if you want to show that. So for those of you who have to go, you can leave now. Of course, you're going to miss the best part. No, I'm just kidding. But anyway, I want to thank you guys for coming. I hope you enjoyed something, learned something, spread the word. We'll see you next time, and have a great afternoon. Thank you. Thank you.